Hey guys, it's Dr. Bailey from Dr. Bailey's Evolved Health and Wellness. Another Medical Monday here. Just kind of getting things wrapped up from clinic and getting switched over. We'll give everybody just a moment to get online here. Today we're going to do a brief talk, kind of finish up over our discussion that we started last week over pain, cannabis in general, terpenes and whatnot. I hope everybody had a great weekend. I know we've got it's actually pretty nice out right now. It's getting into that fall weather. Um, October 24th, don't have anything going on. I'll be fighting over in Oklahoma City. I know you guys have heard me talk about it a lot. We're giving away some tickets for that. We should be able to announce those winners probably sometime next week. Make sure and share this video out if there's anybody that may be interested in hearing about these type of things. Today we're going to talk a little bit about neuropathy. I apologize. Some of the causes and whatnot, and then terpene profiles as well. Hey, Miss Kay, Miss Levita, Miss Sue, how are y'all doing? Again, if there's a topic that you guys are really interested in, neuropathy was something that was brought up a lot in the comment section. I didn't get to go through and comment on each single one on the last video from last week, so something I wanted to try to add to for this week. There's a lot that goes into neuropathy. Obviously, I'm going to try to address the biggest topics that we come across the most, being in the Midwest United States, typically being um, diabetes mellitus type 2. Type 1 as well can cause that and has some issues. Let's see here. Make sure I'm getting everybody caught up. Beautiful. Now, big things we want to talk about. So pain. We started on that last week. Pain is one of those things that it doesn't it's not something we can stick a thermometer on your head. COVID right now is the big thing. So everybody's talking about, temperatures when you're walking in and out and you're screening your temperature. Can't put a thermometer on your head and measure your pain. And I just this may get me in trouble, but I just had a discussion this last Thursday with the Arkansas Medical Board, who I can tell you is not a big believer in medical cannabis, or at least several of their physicians told me that they were not a big believer in medical cannabis, and it is what it is. But what we have to try to get over to most practitioners is that pain. That's what's gotten us an opiate epidemic, honestly, and it's not even to do with anything other than the fact that it's not something we can measure. It's like anxiety, it's like depression, it's like anything else along those realms. It's a symptom, but it's not something we can stick on and say, hey, your pain is at 98 out of 100, whereas compared to temperature, it's 98.6. So the big thing from that perspective is remember, hey, just because you're talking to somebody about pain, they may not look like they have pain. And I struggled with this in the ER for a long time, and I still to a degree do. From the standpoint of I know what can happen, what badness can come from long-term administration of narcotics and opiates and pain meds. We try to avoid those. Now, skipping ahead a little bit, neuropathy, that was a big thing. So diabetic neuropathy, what is it? Basically, over time, you have a ton of extra blood sugar floating around through your bloodstream. The body is a hugely miraculous thing, right? If you give it the right tools and allow it to work, what it will do is it will try to establish homeostasis, or where it feels normal and balanced. So what it'll do is it'll take that blood sugar that's not supposed to be in your bloodstream. And when you have diabetes or glucose intolerance, insulin doesn't respond the same way. So instead of, insulin's like a little key. It goes in, hits the receptor, opens it up, and then sugar goes out of the bloodstream into the cells where it can be used. Well, in diabetes, it doesn't work so well. So what happens is that blood sugar starts to accumulate inside of the blood vessels. So to get it out, the body starts pushing it into things. It'll push it into the linings of the arteries. It'll push it into nerves. And usually what happens is the smaller nerves are basically what's going to be affected, which is where you get that tingling, sometimes some brief paralysis. You have some people have some issues with proprioception, which is like if you to close your eyes, stand on one foot and lift your foot up, where about your foot is lifted up above the ground, your other foot's on the ground, you have that sensory capability. A lot of times diabetics lose that. So two parts to that. To treat pain, especially diabetic nerve pain, the number one thing we got to do is we got to try to get you cured of your diabetes, which we can now do. We know that we can do it. For decades, we didn't think we could. When it comes to cannabis, cannabis works in a couple different ways. Both THC and CBD are both effective at fighting pain, just for different reasons. THC binds CB1 receptors much more intently. And so where do CB1 receptors lie? Along the nerve cells. All right. So if you're looking at something from that perspective, it can calm down when the nerve cell gets, I hate to use the word, but fired up and irritated, it can help calm that nerve cell down and help that response there. CB2 receptors, and when you start looking at CBD and even CBG and some of the other components down the line, they work by decreasing the inflammation associated around those nerves. So when you have irritation and injury, you almost always get release of leukotrienes and some other chemicals in the body that cause inflammation. So by adding CBD and THC in there, you're almost always going to get a dual-edged attack on that pain, especially neuropathy. That's why so many times when I'm talking, especially to new patients, I tell them in renewals, hey, there's really not a better medicine on the planet than cannabis when it comes to neuropathic pain because of the fact that you can hit it from two different directions. Now, when we start looking at terpenes, honestly, it's the same terpenes over and over and over again. But one of the big things I wanted to look at and talk about was caryophyllene, which I've talked about before. But caryophyllene was one of the first terpenes, which, and I hate to say this, but terpenes basically just brothers that are cousins of essential oils. But caryophyllene was found to actually hook onto a CB2, I believe, receptors and initiate a response. So that right there kind of gives us that little bit of information that you need when you're saying, hey, how do we get medical response out of essential oils or terpenes or whatever it is that we're trying to look at? Caryophyllene will do that. And so that right there will actually lead into that entourage type of effect that you hear about all the time, the combination of endocannabinoids, the combination of terpenes. You know, when you strip out part of it in the production of a cannabis product, you're losing some capabilities there. And so that's a big deal. Your other terpenes that help out that we know have significant benefit, and we've talked about them all. Myrcene is the number one terp. It's in just, man, it was a huge number of cannabis strains and varieties. Linalool, limonene, alpha pinene. Pinene was good for both the nervous system as well. And it'll be another one that's kind of right there with caryophyllene. Um, Typically, I'm a big indica type person, and I know that there's uses for sativas. My only concern with sativas is obviously the panic and paranoia that can come along with a lot of, especially when cannabis naive patients that aren't prepared for that. But we see that the hybrids and 60-40 hybrids especially do an exceptionally good job of helping to take care of those types of pain issues. And the reason being the simple what we talked about earlier, the combination of CB1 and CB2 receptor activation gives you double pain relief in the realm of neuropathy. Pain, very, very, very broad subject. And it was something that when it's something I hear about all the time and something I get asked about a lot. So, what all can we do? And, I'm a big believer in being the person that if I tell you to do something, it's something that I do personally. If I tell you, hey, you should try this, then it's something I want to try personally. So what I typically tell people is, hey, diet is huge, and I get it. Trust me, it's the COVID-19, COVID-20, COVID-40, whatever is a legit real thing. And I use my fighting a lot of times as a reason to lose weight. Because 4th of July I got 204 pounds. Right now I'm about 164 pounds. October 23rd, I'll weigh 145 pounds. Now I will gain 20 of that real quick. But the whole purpose of talking about that is the pressure that we put on our low back, and especially in men, but in women too. If you take 90% of back pain and you draw a line from your belly button straight to your back, that's where 90% of back pain occurs. And so we can fix a lot of that stuff by simply cutting back on what we eat on, or what types of food we eat, or how we eat. Then you add inflammatory benefits from cannabis. improves sleep. You know, I've got this deal right here. It's called a Whoop strap, and wasn't a big believer in some of that stuff at first, but then the more I've watched it, and what it does is it constantly measures like 200 different measurements an hour. But the reason that's important is because it follows your heart rate, follows your respirations while you're sleeping. Now, how does this sleep and cannabis and all that stuff tie into pain? What you're going to notice is that it's like 95% of folks with chronic pain issues develop anxiety and depression. And 100% of those folks develop sleep issues over time. And so one almost always contributes to the other. So how do we treat pain? Okay. So we just went over, you know, CB1, CB2 receptor activation, trying to find a good hybrid strain. Does an excellent job of providing both receptor activations. Terpenes, caryophyllene is a huge one. Then it goes in your myrcene, alpha pinene, linalool, limonene. Those are all great terps that will help treat pain issues. Then sleep and diet, big things. You know, and too many times I hear folks say, "Hey, I hurt, I can't exercise." That's fine. We'll get you there. But if you'll do these basic steps first, take baby steps with this, it will start to get better. All right, let's see here. What all else we got on here? Again, guys, feel free to drop questions if you have or comments. If there's something that you're interested in hearing about, I want to talk about things that interest y'all. I want to talk about things that are going to be beneficial to the patients in both Oklahoma and Arkansas. Real quick, because that's kind of the biggest issues I had right now in pain. I will come back to pain, and I'm going to start trying to break it up individually. Um, you're very welcome, Miss Shanna. And try to address like I did with neuropathy today. I've done a little bit of talking on fibro. I'll probably look into arthritis and the degenerative disc and joint disease coming up in the near future as well. So much of this again. Another thing I'd like to maybe hit on is like supplementation as well. Whether it's you know, herbs and remedies on top of, you know, cannabis, on top of good quality sleep, on top of good quality, you know, high levels of water intake, those types of things. Because I hear it all the time, guys and gals. I don't want to take meds. That's why I want to use cannabis. That's great, and I'm all on top of that right now. The thing that I want to see though is you can do this if we're not doing self-destructive behaviors. Smoke cannabis, stay blue in the face, not going to hurt you anything compared to what cigarettes are going to do, right? You know, in Oklahoma, Arkansas, Missouri, Kansas, right now, I mean, yeah, it's a bad thing when it comes to tobacco. So I'm all for trying to help folks as much as possible. I I've set Evolved up as a resource. So if you get into this and have big questions, shoot a message over. If I can answer it quickly, I will. If I can't, I'll say book an appointment. If you need a renewal for your license, get on there and book an appointment and do it soon. We are booked out right now till November 5th, so exactly 1 month out. Now, a week of that, I am gone. If you need a renewal and your card is going to expire, shoot me a message on Facebook or shoot me an email. What I've been trying to do, and I can't do it for everybody because trust me, there's a lot, is I will have you book an appointment in November and I will fit you in. I will start clinic early one day to fit you in ahead of time if at all possible. Okay. Um, let's see here. Make sure I got every chemo-induced neuropathy. Okay, Miss McLaughlin, that was actually a really good topic. Um, here's the problem with chemo-induced neuropathy is there's not really a source that you can treat per se. Now with diabetic neuropathy, same thing. Once you have diabetic neuropathy, there's no getting rid of it, but you can prevent it from getting worse. Now chemo-induced neuropathy, same type of thing. Unfortunately you're in a bad position. It's not self-induced. There's not a lot you can do about it. And when you talk to your oncologist, you have to really decide, hey, I'm starting to develop this, and it's going to be one of those moments where you have to decide, is the pain better than the alternative, or you want to switch chemotherapeutic agents, you just want to stop therapy. What would you like to do? Same principles are going to apply though, and the reason being is that pain comes from the damage. Sometimes it's the myelin sheath, which is the same thing happens in MS, is it breaks down the myelin sheath, which is a waxy coating that goes around the nerves and helps the nerve signal travel faster. That's why you can put your hand on a hot stove and immediately pull it off because it hurts and you notice it hurts. That's how fast that signal moves. So that is something to think about. But you're going to have the same benefit in chemo-induced neuropathy as you would with diabetic neuropathy. The only difference between those two really is chemo can affect a larger subset of nerves. Diabetic neuropathy is typically a smaller neuropathy. It's polyneuropathy, and it's usually lower extremities, but it can be in a bunch of different areas. One thing I was going to mention, I forgot. So diabetic neuropathy, especially, all my folks that are diabetics, when you in your shower at somewhere, and they sell them all over the place, you should have a mirror on the floor of your shower. And the reason is that way you can check the bottom of your feet anytime you shower to make sure you don't have a cut there or a small wound there. The problem is, like we talked about earlier, when you have diabetic neuropathy, you don't feel it. So what happens is people get small cuts and don't realize they're there. If it's the bottom of your feet, you're walking around barefoot, or if you're you're working all day and your feet happen to sweat, you can get infection and wounds there that develop, and you won't be able to heal them. So preventative maintenance is big, especially in our diabetics. Let's see here. Miss Levita, 20 years ago. Miss Shannon Watson, I'm experiencing, let's see, neuropathy caused by an injury 20 years ago. So it depends on where the injury was at, and nerve issues are difficult. And so, like for right now, I've got preparing for fights and everything else. I have what's called ulnar nerve entrapment. So, basically your funny bone on both sides. If I fall asleep with my hands and arms bent, I wake up and these three fingers are always numb. Now, recently, just from punching heavy bags and doing some stuff like that in this wrist, I've started to have worsening in my hands. And that's a physical or mechanical issue right there. It's not going to be the same. But the good thing about a mechanical issue is most of the time it can be repaired in some way, shape, or form. Again, that's going to be a time when inflammation and anti-inflammatory is just going to be your much better treatment option there. Let's see here. A big thing with neuropathic pain as well, and I hate to put this underneath neuropathic pain, but sciatica is something I hear about a lot. I'm actually going to type over here in the comments section. It's called the piriformis. You can look up the piriformis stretch. It depends on where the sciatic nerve is impinged. What you have to realize with sciatica is the piriformis nerve, or the sciatic nerve, is about the size of my thumb. It's a large nerve. It comes out from several different nerves come out of the sacrum and the lower lumbar spine, fuse into one big nerve, and they travel down the leg. Well, as it exits the pelvis and heads down into the leg, it runs, and not in everybody, because there's some congenital differences there. It runs through the body of the nerve of the piriformis muscle. When that muscle gets irritated, it clamps down on that nerve and shoots pain. Now, it typically stops at the level of the knee where the nerve splits into the perineal and anterior tibial nerve, I believe. But piriformis stretch will help a lot if it's that muscle that's inflamed. That's why men, if you have sciatic pain, don't have a billfold in your back pocket. A lot. I guess I just took mine out. I have the smaller, thin carbon billfolds that have RFID and stuff that you just slide your cards into it. Since we're not really a big cash society as much anymore, that's another alternative as well, especially in sciatic pain. Now, if it starts in your lumbar spine, not as easy. And that's when you start talking about surgical interventions and whatnot, depending on, again, your tolerance for pain and those types of issues. 1-year-old in my hand, my head. So Miss Shanna, so she basically has hip and neuropathy pain from a fall where she struck her hip and her left buttocks. So same thing, kind of like I was just talking about there. Most likely, and I'll tell you, I'm as a physician and as a person, I'm kind of 50-50 on chiropractors. I've met some phenomenal chiropractors. I've met some that aren't so great. A good solid chiropractor needs to be able to do a couple different things, but the number one thing that a good chiropractor needs to do, and I say this as a DO that's trained in manipulation, you need to be able to address the muscles. If you walk into a chiropractor's office and you sit down and they fill you out, but if they don't stretch you out, if they don't do east end beforehand, if they don't do anything to bring that muscle out of spasm into relaxation, As soon as they adjust you, that muscle spasms back up, pulls you right back out of alignment. Before you're even to your vehicle, you may feel good that long, but you sit in your car and drive home, you're gonna be back out of whack. Which is why they say you got to come back 3 or 4 times this week, got 3 or 4 times the next week, then 2 or 3 times the next week, then 2 or 3 times, and one or two, and then so on. I've got a couple good chiropractors that I really recommend here in the Tulsa and Broken Arrow area. By all means, feel free to reach out. But Miss Shannon, that's something I would really look into. Um, Look at that stretching. Stretching and mobility is a big, big deal. And I say that as a professional fighter. I say that as a military guy. I really, really, and I don't do it as much as I should, but sitting down and getting into a big, deep stretch of both the hip and low back provides phenomenal amounts of pain relief. All right. Let's see here. Any other big questions? You guys have been awesome. I will. I'll let you guys go. Again, topics. If there's something that y'all want to hear about, please shoot me a message. Let me know. Again, October 24th, Oklahoma City Farmers Market. Probably gonna be my last chance to fight this year. May not fight again until February or so next year, depending on Corona and the schedules and stuff. I promise you, it's gonna be a good night. It's gonna be an entertaining night. Come check it out. I'll put the link in here for the tickets to Rage in the Cage. That way you guys can grab those if you want. Also, we're going to give away some seats to that as well. So if there's anything that you guys are curious about, whether it's the fight, whether it's training, whether it's whatever it may be, we have some cool things that are going to be coming up. I am going to be meeting with some companies about a possible product. There's something I'm really interested in doing. I'm really interested in coming up with a topical product that we can use for pain relief, especially since we're talking about this right now. We'll hopefully have some new updates on that soon. All right, everybody. I hope everybody had a great weekend. I hope everybody has a great week. And if there's anything I can do to help, I'll be glad to help in any way I can. Thank y'all.